We live in a time of incredible technological change happening all around us. But it's kind of crazy that the one part of our lives that hasn't really changed at all is the doctor's office and meeting the doctors for a consultation. So my grandfather, who had a practice like over 100 years ago, wouldn't understand much about this world, but that part he would be completely familiar with. So the healthcare system we have today, or the model of healthcare, hasn't really changed like in the last 200 years. You go to the doctor when you're sick. There's no way for that system to be proactive or to be preventative. What if we completely switched the model of healthcare? So rather than reactively treating the sick, which is what we do today, to intervene and keep people healthy as long as possible. I'm Hjalmar Nilsson, and I'm the CEO and co-founder of Neko Health. The good news is that most of the chronic diseases that are burdening our society and healthcare system so much are actually completely reversible if you catch them in time. The problem is, of course, we don't. We think a different healthcare system is possible. A healthcare system where problems are found years or decades before you have the serious issue, giving the individual and the system a lot of time to correct the direction and make sure that things don't go wrong in the first place. When you come to a Neko Health Center, the first thing that happens is that you get checked in by one of our operators. Throughout the entire scan, you'll be together with the operator, who's a trained medical professional, and you'll also meet a doctor who will review and discuss the results with you. And the scanning starts with a standing up scan, and we take high-resolution photographs of every inch of your body. This allows us to create a reference image of your whole body. So the entire scan takes about 20 seconds. So at the end of the 20 seconds, we have every inch of the outside of your body. We have your entire shape of your body mapped out, together with a temperature profile of your entire body. The second part of the scan is you go over and you lay down on a bed. There we do a cardiovascular assessment, where we measure how your heart is beating and pumping blood, and how that blood is moving through your entire arterial tree. We measure the pulse at 7 different locations throughout your body to understand its shape. And this enables us to do a much better characterization of the health of not just your heart, but your entire arterial tree. Then we check your microcirculation. These are the smallest blood vessels in your body, and we assess their capacity to supply your cells with what they need. It is believed that issues with these vessels are a common starting point for disease development. So after that part of the scan, we take a simple blood draw, where we check for essential blood tests that we process on site. The second part of the visit is going into the debrief room with the doctor. You spend about 10 minutes in the scanning room, and when you meet the doctor, all of your results are already fully computed, calculated, analyzed, including the essential blood tests that we've done. So the entire session is just for you to talk with the doctor, to go through all of the results. And we do it in a very different way from a traditional doctor's office, where there's no desk, there's no keyboard, there's just a big screen with an avatar of you, with all of your health information mapped onto this avatar, and a doctor to walk you through every step of how to interpret that data. So after your scan, you've now created a baseline of your health that we can start tracking across all these different domains. And of course, you have access to this information in our app, where you can go in anytime and look at your values and share them with your doctor. In the Neko Body Scan, we really focus on providing actionable insights, where the members are presented with something that they know what to do with. And we do not believe in sending people home with information and outcomes that they don't understand, that then they need to go out and seek other input on. With the kinds of technologies that we develop at Neko, where you can collect and analyze tons of health information, combined with incredible advancements in AI, we think we might right now be at an inflection point where there's going to be huge advances in the detection of disease and ultimately also in the prevention of disease. And this is why we're on this journey with Neko Health.